Is hereby resumed. This afternoon we will hear the proposed budget for 2015 of the NCMF, the ARMM, the DDB, MINDA, and PIDEA. As per the request of Senator Poe, sinahin po natin ang DDB at saka ang PIDEA. So on the part of DDB, they have a presentation, sir.
Mr. Chairman, distinguished members of the committee, Senator Poe, our chairman sent a letter already to the CAM. So with your permission, Mr. Chairman, may I ask that we recognize ASEC Benji Reyes for the presentation of the budget of the Dangerous Transport.
Bebo signed the letter? You didn't sign it. Sabihin mo, miss ko na firma niya. Anyway, who will make the presentation?
May say something before we begin with the
Please.
presentation. I'd like to congratulate our PIDEA USEC Arturo Casda for your recent accomplishment in the 4 billion drug bust in Pampanga. Congratulations, sir, and for the many others, for the many other operations you've had. Your efforts are not lost to the public. Thank you for protecting many generations of children who have been saved because of your efforts. Thank you, sir.
How long is your presentation, Secretaries?
Sir, I'm just going to discuss the program trust of the dangerous transport, and then I'll proceed immediately, sir, with the budget.
How long, sir?
Sir, about 10 minutes, sir.
Make it 7.
Okay, sir. Sige, sir.
Please
I'll
proceed,
do my
sir.
best, sir.
Please proceed at magandang hapon po sa inyo lahat.
Good afternoon, Your Honors, Senator Paul and Senator Cheese. Let me begin by presenting the trust of the dangerous transport. Basically, Mr. Chair, we want to spend our money to continue supporting the drug supply reduction efforts through the issuance of policies for law enforcement. We want to support the continuing education for law enforcement personnel. Next page, please. Of course, we want to formulate additional policies to strengthen the anti-drug law and address emerging issues. Support the strengthening of the National Drug Education Program of NDEP. Please. Implement the drug abuse prevention program for Scoutmasters. Support the institutionalization of the National Service Training Program for CHED. Next. Widen the involvement of faith-based organizations and other professional groups as far as drugs is concerned. Next. Continue to support the implementation of drug-free workplace programs. Support the conduct of capacity building programs. Next. Institutionalization of family drug abuse prevention programs. Of course, supporting skills development for out-of-school youth. Next. Support special studies for researchers, enhance monitoring and evaluation of existing programs based on the National Anti-Drug Plan of Action. Continue assessment and monitoring of treatment and rehabilitation centers. Next. Continue providing financial support to these rehabilitation centers. We want to support the implementation of a one-stop shop for treatment facilities. Support the establishment of community-based treatment facilities. Formulate policies in support to the inclusion of recovering drug dependents and the coverage of the conditional cash transfer being implemented by DSWD. We want to enhance communication plans, expand the use of information technology, enhance partnerships, develop more effective evidence-based advocacy campaigns, provide financial and technical support for the implementation of economically viable, sustainable alternative development programs, especially for marijuana growers. Encourage the involvement of local government units, community members, and other concerned agencies. Sustain cooperation of regional and international counterparts, and finally maintain linkages with regional and international networks. Mr. Chair. So, Mr. Chair, this is the proposed budget. Just to compare, Mr. Chair, our 2014 budget with that of our latest National Expenditure Program approved by the DBM. Basically, you can see, Mr. Chair, that we have a reduction of around 1% from our 2014 budget because the capital outlay of 1.2 million was removed from the current 2015 budget. Just to show you, Mr. Chair, that we proposed 215,925 as our requested allocation. However, what was approved was only 181, as mentioned, Mr. Chair. So that's it, Mr. Chair, for the dangerous drugs board.
Sir, just a few interventions and questions. Do you have a copy of the net with you now? May I also advise the others to get a copy of the net because we're raising the questions in the net. You have a copy?
Sir, this is our net proposal.
The actual net. Copy ba yan yung libro, please? Asset, ito kopya. Pakibigay kay Asset Grace. So that we're literally on the same page. Kindly photocopy the portion of the net for the other witnesses that will be here this afternoon. Sir, page 942. Yung 77 million na pondo ninyo on top of the 181.
It's already included, sir. Part of the 181.
Kasama po yun doon. Magkano talaga to? This is what DBM is giving you. But may I ask, how much really is this fund? Magkano yung shares ninyo na nakalagay dito?
Yung sir, yung 77 M po, yan po yung pinoprovide po sa amin ng PAGCOR PCSO, sir. Specifically under the law for construction and support to treatment and rehabilitation centers.
Pati yung sa Philippine Racing Club?
Kasama.
Is this an exact amount? Yes, sir.
Respond.
Yes, sir. Colonel.
Your Honor, based on the provisions of the law, we're supposed to get at least 1 million from PCSO and 5 million from PAGCOR every month. And according to the special provisions of the budget, a certain percentage from 10% of the unclaimed winnings of Lotto, lottery, or whatever, and from Philippine Racing Commission, Manila Jockey Club. We are not provided any gross amount where this a certain percentage of which is given to
That's
us.
exactly what I'm asking, sir.
So that what we are just we have written PCSO about this, but we have not gotten any response. So that what we just received is what DBM gives us, which is for the past 3 or 4 years, back to 77 million. Your Honor.
Saan po galing yun? Why not 70 million? Why not 80 million? Why not 100 million? Saan inugot po yung 77 million?
Apparently, Your Honor, they got this from the 1 million, at least 1 million given by PCSO every month, and the 5 million given by PAGCOR every month.
Kulang pa rin.
Plus,
5 times 12 is 60.
60.
1 times
72.
12 is 12, 72. It's a Philippine Racing Club.
apparently, the others would have been gotten from the Philippine Racing Commission, Manila Jockey Club, and the like.
But that's the minimum.
Yes, Your Honor.
The law makes mention of a percentage. Diba?
Yes, Your Honor.
Asibres?
Sir, if I may add, sir. Actually, we collect from the following agencies for last year, for 2013, sir. We collected a total of 498,000 pesos, sir. No, pero yun na nga, sir, as mentioned by Yusek Galvante, only nakapeg na po, sir, na 77 lang po ang release po pa sa amin ng DBM.
Yung nakalagay po ba sa RA 9165 ng PAGCOR, 5 million a month, nakapeg yun? Yung sa PCSO, percentage yun.
Supposedly, at least 1 million, Your Honor.
Pero percentage siya. But not to go below 1 million.
Yes, Your Honor.
In case the unclaimed forfeited sweepstakes lotto does not reach 1 million, dapat bigyan pa rin kayo ng 1 million.
That's true, Your Honor.
But if it exceeds that amount, you should be given the percentage share. You never got the figures from PCSO?
They have not responded. In fact, we were requesting for what is the basis of the amount. It's just too bad that they have not responded.
On the part of the Philippine Racing Club, same.
Yes, Your Honor.
Sumulat na rin po kayo.
We have not written the Philippine Racing Club, Your Honor.
Secretary is directed to kindly communicate with the PRC and PCSO in order to get the data as provided for by law on the share that should be given to the DDB under RA number 9165 and RA number 8407 insofar as the PCSO and Philippine Racing Club Incorporated respectively is concerned, and likewise to furnish a copy to the DBM for them to respond as well. So ordered. Sir, I may point you to page 944. Just a random question. MFO1, Development of Advocacy, Information Programs and Materials on Drug Abuse Prevention and Control. You have an MOE of 24,653,000. Do you have a breakdown of this?
We can submit this, Your Honor.
By way of example, saan po gagastusin to? Sinong...
Every year we have International Day Against Illicit Trafficking of Drugs, and this is one of the expenses that we have
Examples of
included
that.
here. In celebration of, in observance of this yearly event, which is done worldwide.
Example, sir. Just to give us an idea. Nagpiprint kayo ng tarpaulin, nagpapakain kayo ng tao. I mean, what's an example of an expense under this item?
That's just some of the examples, and we sponsor programs, seminars, workshop to this effect, and the purpose of adapting new trends in drug prevention and control.
Under MFO1, formulation of policies, plans, and programs for solving dangerous drugs problems. 3,815,000. Is there an itemized breakdown of this? Down to the last 5,000 po ito. It's not 3,820. It's not 3,800. It's 3,815.
Again, Your Honor, we use that for coordinating with the allied agencies, stakeholders, and undertaking researches. Although some of these are social researches.
Do you have an itemized breakdown of this as well?
We can provide, Your Honor.
You don't have it right now, do you?
Can we provide this a little later?
Still under MFO1, same item. PS, 6,546,000. Sino po yung sinusweldohan under this PS for formulation of policies, plans, programs for solving dangerous drugs problems?
The PS money is for the salaries and allowances of all the personnel of the board.
Not all, sir, because each MFO has a specific and separate PS.
Yes, Your Honor, but actually that's not the PS. The total PS of the board has been spread. Whether he is a staff, when he is a staff of the DDB, all this, the salaries and allowance he receives does not come only from one source, but rather the supposed amount is spread based on the directive of the BM that a contribution coming from that source of fund is given to the salary, since he performs jobs concerning with the...
Sir, so this 6,546,000, walang katumbas na pangalan at pwesto to?
Sir, if I may, yung for MFO1, Mr. Chair, it funds the salaries of the PSRP division, Mr. Chair. So
Everyone
we have
in
a
that division?
Yes, sir.
Everyone in that division?
Yes, sir. Plus Ponce.
So, for each MFO na may nakalagay na PS, you can submit to us kung sino-sino
Yes, sir.
at ano-anong pwesto ang nakasama doon.
Yes, sir. Even the unit, sir.
Kindly submit that to us, sir. Now, on page 946, sir. Honoraria, 2,627,000. Sino pong binibigyan natin ng honoraria?
We invite resource persons for seminars and conferences, and this is what is extended to them.
How much do you give per?
Depends on the level of the invited resource person.
The range would be?
And about 5,000, 7,000 like that. For example, in the seminars for judges, prosecutors, and law enforcers, where we request the presence of justices to the Supreme Court and the Court of Appeals, they are given the peg amount given by the Judicial Academy,
Which is
is
how
about
much?
7,000.
Can you give us, sir, the policy issued by DDB on the giving of honoraria to certain levels? Kung tignan magkano kung meron ako.
We will do so.
Please do so, sir. Same page, 946, other compensation for specific groups, Magna Carta for public health workers, 1.230. What is this about, sir?
This is given to as additional allowance to employees per the Magna Carta.
Na health workers.
Yes, sir. And somehow the DB personnel has been classified to belong to this category.
Extraordinary and miscellaneous expenses. Correct me if I'm wrong, sir. 1,022 million.
Yes, Your Honor. That's provided to the chairman, the members of the board, in their committees as expenses. For example, if the committee chair of the board schedules the seminars, conferences, that's the one spent for the activity, Your Honor.
Advertising expenses. Ano po
Actually,
yung
we
advertise
don't
ng DDB?
advertise, Your Honor, but rather we use the money. For example, if we issue regulations, it is required that this be published in major dailies. And some programs and activities where we have to give public notices. For example, if there is a public hearing on a consideration of a substance being listed, we send out public notices, Your Honor.
Membership dues and contributions to organizations, 22. I know it's a measly amount, but still we would want to know.
Yes, Your Honor.
Sino
A
binibigyan?
requirement or a part of the arrangement is that we provide Colombo Plan with our supposed donation, the amount of 7, I think. We have 5,000 contribution to Colombo Plan and 17,000 as membership, Your Honor.
Ano yun?
In dollars. Colombo Plan, Your Honor.
What's that, sir?
This provides assistance in training for drug prevention and control for all the member countries in the Asia Pacific, Your Honor. Philippines is one of the members, and this is made up of around 44 countries, Your Honor.
What's the name of the organization again, sir?
Colombo Plan. This is based in Sri Lanka. I think, if I am right, Your Honor, this is a counterpart of then the Marshall Plan, which was implemented in Europe, and this was implemented in Asia Pacific as a contribution to the development of restoration of the devastated countries during the Second World War, Your Honor. This is around in the 50s, early 50s when this was established, Your Honor.
Before I turn it over to Senator Poe, sir, can you kindly submit to us your letter to PCSO? Yung latest letter nyo inquiring about the gross amounts
We will do that, Your
of
Honor.
the unclaimed prizes.
We will do that, Your Honor.
Thanks, sir. Senator Poe is recognized.
Thank you, Mr. Chair. Just quick answers. How many drug dependent Filipinos do we have now?
In the estimate that we have found out per household survey, it's around 1.3 million, Your Honor.
How many rehab centers do we have?
Sir, while you're asking
Yeah.
your staff, based on household survey, 1.3 million.
Yes, Your Honor.
So umamin itong mga to na drug dependent sila.
The survey, we follow the same survey preparations, protocol that the uh, professional survey entities are doing.
Who did the survey?
PNU Research Center and the DB, Your Honor.
So essentially, umamin. How do you know?
Anyway, during the questionnaires, it was deduced, Your Honor. There are questionnaires that they respond to. Of course, we cannot say that we guarantee that those questions would really give out a true answer. So that there is about a 5% margin of error, Your Honor.
So out of curiosity, can you just show us the reason behind it, kung ano yung logic, kung bakit? I took the exam for owning a gun last week, and the questions asked were bordering on mundane and insane. I'll give you an example. Nagagalit ka ba pag iniinsulto ka ng kaibigan mo? No, true or false eh? Nagagalit ako pag iniinsulto ako ng kaibigan ko. True or false? Eh di syempre, nag-apply ka ng baril, di ba? Dapat hindi man itulo mo. False. Madaling uminit ang ulo ko, lalo na pag kulang ako sa tulog. False pa rin, di ba? I mean, kindly submit us the methodology, sir, out of curiosity. Just
We'll do that, Your Honor.
Thank you, sir.
Thank you, Mr. Chair. We recently, the President recently signed the Republic Act 10640, which is an amendment for Section 21. Have you been able to apply it recently?
Your Honor, if I may, I think it's more effective to the law enforcement since they're the ones actually.
It's more for PDEA
PDEA.
later on.
But in response to your earlier question, Your Honor, we have a total of 40 DOH accredited drug rehabilitation centers, 14 government and 26 non-government, Your Honor.
So the rehab centers, you're coordinating with the DOH, but the DOH is the main agency running this.
Yes, Your
So
Honor.
they're the ones also accrediting health personnel to manage. Do you have one per region, or how is it distributed?
Your Honor, the if I remember right, the DOH is also trying to see to it that at least there's one per region. I think while they have a dedicated treatment and rehabilitation facility per region, at least they have appointed a big hospital in each region to have that wing or
The rehab
service.
center. I think you also mentioned that you have this alternative livelihood for marijuana planters. Do you have any recently?
Your Honor, we have been trying to push this continuously, except that during the time that we piloted this was when we have some sort of savings that we realized. So we started this in Kibungan, Kapangan, Bakun, silkworm program, where we gave them some seed money, and they organized a cooperative in their municipality, and they
When
were
was this,
selected.
sir?
About 5 years ago, Your Honor.
So of recent, you haven't really.
They have been requesting for continued assistance, but however, we don't have funds. We requested for some funds to push this program. However,
But you haven't identified a new community that needs alternative sources of livelihood.
we have been receiving requests, Your Honor, but we cannot positively respond because of lack of.
If you've
funds.
been receiving requests, are these communities are currently still planting marijuana? Most likely. So I'm sure you've given your lead to PDEA.
The process, Your Honor, is that we talk to the local chief executives and ask them what could be a possible way of convincing them not to plant anymore. In lieu of that, we are offering the services that we can provide. For example, like this agriculture program, we had a talk with the then mayor of Kibungan and Kapangan, and they said that this would be interesting to the marijuana planters. If we can provide them some assistance, they are going to sort of get a core.
So what you're saying, sir, is for your budget now, you don't have an allocation for that type of program.
That's true, Your Honor.
Because
we
of the
only,
cut
yeah,
that
we,
you-
we provide only if we realize some savings.
Okay. Well, that's noted because I think that's quite important. But you also need to be able to identify those communities that will need it.
Yes, Your Honor.
Now I guess that's it for now, Mr. Chair. Let's go to the next.
Thank you, Senator Poe, rather, conditioned upon the submission of the documents earlier requested by the chair, the proposed budget of DDB is recommended to plenary for its final approval and deliberations. Congratulations, and
Thank you, Your Honor. Thank you.
pakisabi kay Bebot, makita kamo kami sa plenary.